Hi everyone. Yet again, I am doing this as I drive. Sorry. Alright, new update. I just had my psych eval. It was over the phone. The psychologist woman is in Illinois. I wasn't prepared for this. I guess I'm not really sure what I expected. She emailed me last week and sent me over the Minnesota multiple personality inventory, something to that. The MMPI is what it's called. Filled that out. That was like the psych semester of nursing school all over again. Anyone who has been through a psych course will understand that. It is 530 questions that make absolutely no sense. Like, do you wish you were a boy? No, I don't wish I was a boy. Or, do you often have thoughts that you would like to stab someone in the face? They're just so random and so bizarre, some of the questions. I think I laughed through half of it. Makes it worse because I kind of know a little bit about the evaluation, so I kind of knew what each question was looking to fish out of me. It was very funny and entertaining to read it and actually take the inventory questions that I learned about in school. So fast forward to today, I had my little talk on the phone with my psychologist lady. Be prepared for those of you who have not done it. Be prepared because there's some tough questions. Easy stuff, they take a general history about you and your family, about your previous births, people who are involved in your life. They want to know about your mom, your support system. They want to know if you've had any positive reactions, negative reactions to the, telling people about you being a surrogate. They want to know your husband's history, your husband's family history. We have quite a distinguished family history, so I feel like my little interview part took a little bit longer than it normally would have. But we got through it. It's all good and well done. And so she got to the hard questions, being that about how many embryos you'd be willing to transfer. And I didn't really anticipate having a hard time with this question, but when she kind of broke it down for me and really thinking about the clinical side of it and how it works better to have more put in so that hopefully you get one that sticks and increases chances of a baby staying in there, what made it a little bit difficult for me personally, mainly because I am a labor nurse and I deliver these patients with twins and triplets and quadruplets. I have them in my unit at 23 weeks on bed rest because their body just isn't meant to handle that many babies. And I see these babies be born at 27 weeks. I've delivered quads at 27 weeks, I think she was. I delivered triplets at 31 and 32, and I delivered twins at 36 because her body can't handle it. So that question kind of caught me off guard because I really don't mind having more than one baby placed in there. But at the same time, knowing the long-term implications of it, not long-term, but the end of pregnancy implications of it and the stress it puts on the mother's body made me hesitate a little bit. Then she got some even deeper questions about termination. And for those of you who are just starting this as I am, you need to be prepared that you have some very difficult questions to answer. And these two questions were probably the easiest and the hardest for me. The first one being, if there is a severe medical defect of the baby, would you be willing to terminate? My answer is unequivocally yes, definitely. Again, I deliver patients who have these issues. I deliver these babies. I see when they come out that there is a lot wrong with them. The second question is even tougher, but a quite more simpler, it seems like almost, topic. And that comes to the topic of Down syndrome. And the question is, if it is the doctor gives the diagnosis that the baby is positive for Down syndrome, would you or would you not be willing to terminate based on the parents' decisions? And this is where my personal beliefs clash with my professional beliefs. Professionally, I kind of see this surrogacy as a nurse-patient relationship. I am simply the nurse. I don't want to make decisions for my patients. I don't want to make decisions for my parents. This is their baby, not mine. I'm just helping them get it. I'm helping the outcome. Personally, if it was my own child, my answer would be absolutely no. It's still a healthy baby. It is a special needs baby, yes. And I do understand that there are some very complicated long-term needs for children with Down syndrome. But to me, that's not an excuse. However, I understand that for other families, they may not be able to deal with that. So what's the right answer? Yes, I'm willing because it's their choice, it's their baby, and it is. No, I'm not because it goes against my personal beliefs. It's a very hard question to answer, and I actually have not answered it yet. She's not filing anything until she gets it in writing from me about what my answer is. She wants a signed paper. With good cause, because I'm on the fence about it. And yeah, be prepared for very difficult questions like that. I knew the topic would come up, but I guess put it to me bluntly in the manner that she did, I was unprepared to answer it. It's a yes or no question. I should mention that. It is a yes or no question. There's no, can we talk about it? It is a yes or no question. In the eyes of the psychologist, you get one answer. When I filled out my profile and that question came up about termination, I said, this is a topic that needs to be discussed with the parents before any decisions are made. Me and my husband need to speak to the parents before it is made, mainly because I just want to make myself feel better, I guess, and have my chance to say my piece. Honestly, in my head, I can't see myself going, I'm sorry, you don't get a say even though it's your baby. I feel like that would be taking their ability to choose away from them, even though the lady that did my screening very quickly pointed out and tried to dispel that thought process. She said, you will only be matched with families that agree with your beliefs and that are on the same lines. In other words, they're not going to take a surrogate who says, no, I absolutely do not believe in that type of termination, and pair her with a family who said, we absolutely do believe in that type of termination. Which is helpful, but at the same time, it still does not change my mindset that I feel like I would be taking their ability to make a choice away. The nurse in me can't do that. I can't look at a person and say, what's best for me is best for you. I get to make this decision for you. And that is ultimately what I feel like. So for those of you who are watching this and are going through the psych eval, think about that and think about those really tough questions that the ones you think would never happen to you, think about, because those are questions they ask. And those are questions that they want you to answer, honestly, and you have to be comfortable with your response. So, overall, it was an interesting process, but one that did very well catch me off guard. Another one that I expected but didn't expect what I got back from it was, do you have a support system? Now, most of us that are doing this, I assume, have a support system. I definitely have a support system. My husband is supportive. He is not overly involved, but he is supportive of me, and he is supportive of me because he knows I want to do this, and it's something that's important to me. My mom is super supportive. My children kind of understand. They're older. They do understand, but they all want a baby sister, so they're kind of excited about it, but not really. I don't really know how to explain the kids. They understand that we don't get to keep it, but they are very excited that I'm going to do it. However, I do have some people who have said to me when I told them, family and friends alike, whose immediate response was, Ginger, you are not going to be able to give that baby up at the end of this pregnancy. I know you will not be able to give it up. And I told her this when she asked me, and I said, I am struggling with that a little bit because I didn't anticipate the negativity. To me, this is so positive, and to me, I see the outcome and the, OMG, I get to give somebody a baby. How awesome is that? I get to share that moment with a family. Something I do every day, but even more special because I'm the one who gets to give it to them. I don't get to just support them. I actually get to give it to them. It's like a big, huge present. It makes me super happy, makes my little heart happy. So I wasn't really prepared for the negativity, and I have sounded off on some of the surrogate boards on Facebook about it and got responses, and everybody pretty much says the same thing. Just ignore it because it's your body, it's your decision, and the best way to stop the comments is to prove them wrong. And that's kind of what I'm doing. But make sure you understand your support around you, and be prepared for not everybody being all happy gung-ho. My mom, when I told her, was at the grocery store, and she started laughing, and she told the cashier, I'm going to be a surrogate grandma. She was very excited because she's the same. She's got the same mindset as me. She said if she wasn't so old and so fat, she'd do it herself. Her words, not my own. I'm just making a quote. But she said she'd do it right now, and she's in her late 50s. She's like, I'd totally be all over it. But that's just how we are. But yeah, so be prepared for some difficult questions and some difficult decisions that you may not or may have thought of, but didn't really put much thought into it. I really didn't put much thought into the Down syndrome question until right now, until it was presented with me. I think I sat on the phone with her, just dead air, going, I don't know, for about 3 minutes, because I don't have an answer right off the bat for it. It's a big question to ask, or to ask and to answer. Yeah. So, all right, comment below if you have any questions, or if you have an opinion on the matter, and I will hopefully see you soon with a new update. Bye, guys.